The following is a demonstration of how we are using generative AI to create virtual simulations and to do so in an engaging and efficient manner that we never could before. To get started, I'll highlight that we're currently in the tool called H5P, which is an online assessment tool. So I'll click on Start Simulation here. The first part, you'll see that we're introduced to the simulation that we're about to take part in. And presented with the learning objectives. I'll highlight that our subject matter experts provided all of the core content for what composed our simulations. We then leverage generative AI to help us flesh out those different components. And while we did use AI to help in the composition of these elements, it's important to note that all pieces of our simulations go through a thorough review and editing process. On the next slide, you will see how we are combining multiple AI tools to create some immersive elements in our simulations.
Please provide morning cares for the residents in rooms 101 through 106. Alejandro Hernandez in room 101 has heart failure and will need his TED hose applied before he gets out of bed. He is very hard of hearing.
This nurse that we're looking at right now, she is the result of multiple different generative AI tools being combined. We use one tool that gave her a face that is photorealistic. We use another tool that determined what words that she was going to speak. We used a tool that was able to give her a voice. And then we used one final tool that took all those different elements and combined them to animate her face and ensure it lip syncs accurately to the words that she is speaking.
But there should be a communication board in his room. Marianne Johnson has diabetes with a left below the knee amputation and a prosthesis that should be applied before she goes to the dining room for breakfast.
I'll also point out that we are using H5P's interactive video feature so that as this nurse is speaking out information regarding the different patients, we can click on these blue circles to get more information about who these patients are and what their current medical situation is. I'll now click on Proceed to move on to the next part of the scenario. And from here, learners are presented with the branching question, which allows them to make a determination of which patient they would like to go see. So the learners have some autonomy in how they engage with this simulation. For now, I'll click on Chen Shulin in room 102, and we will go see her.
The nursing assistant enters room 102 and notices that Chen appears frustrated and has removed her oxygen nasal cannula. Chen says,
and just like with the nurse that we have seen here, we have used the same technology to also give our patients a face and animate them in the same way.
I hate this thing. It hurt my nose. Why I have to wear it all the time?
The tools that we're using for generative voice are such that we do have access to different types of voices from different cultural backgrounds, which allows us to have a more culturally diverse set of nurses and patients that we're able to work with. From here, I can proceed, and we get to our first question, which is based upon the information that's been given to us thus far. I can click on the question here. So here I've gotten the correct answer. I can now X this out and proceed from here. You can see that as you proceed, the system does give you some feedback that provides rationale. We'll now proceed to get the final portion of this particular patient's current situation.
The nursing assistant acknowledges Chen's discomfort and initiates a discussion about her feelings towards the nasal cannula, taking the time to explain the importance of oxygen in managing her overall health. The nursing assistant also reflects on Chen's answers and collaboratively seeks a solution.
So this simulation serves as just a demonstration of the capabilities of what we can achieve now through the usage of generative AI for authoring learning content. And honestly, what you've seen here is just within the context of a nursing assistant program, but these tools have cross-discipline implications as they could be used for simulations and case studies in really any form of program. The efficiencies that are afforded to us by leveraging generative AI in the authoring of learning content are substantial. It's also important to highlight that since we're able to bring all these assets into a tool like H5P, we're able to make these sorts of experiences far more accessible in that learners can work with this content on virtually any device. So the ability for students to engage with these simulations and do so on their own time makes this especially useful. Tools like this are only limited by our creativity in terms of what we can create. So there is huge potential in the future for how we bring engaging and authentic simulations and case studies to our learners. I hope you enjoyed this demonstration, and thank you very much for watching.